When they told me, your daughter's never going to be able to eat, and I brought her home feeding her through a G-tube, how am I supposed to even introduce her to foods when they tell me she can't swallow? Natalia was first diagnosed pretty much at birth. We knew that she had something because she didn't have a lot of movement. So they pretty much told us about a month that she was born, after genetic testing, that she had something called myotonic dystrophy. She was in the NICU for 2 months, and part of the discharge was for us to be followed through regional center. And she started getting services when she was 4 months old. They did evaluations and assessments, and they realized that she needed physical therapy, occupational therapy, with feeding, and those were the first services that we received through Regional Center.
Welcome to the Frank D. Lannerman Regional Center's video series. My name is Edward Bettis. I'm the Regional Manager for the School Age Unit. In this video, we will provide information about early start services. Early identification of a possible developmental delay in children is very important. It is important to act early when you have concerns about your child's development. Anyone can refer a child as soon as there is a concern. Early start services are offered from birth to the age of 36 months. Infants and toddlers may be eligible if they meet one of 3 criteria: have a possible developmental delay in one or more areas of development, or have an established risk condition which may result in a developmental delay, or be considered at high risk of having a developmental delay due to possible medical factors.
So when she was diagnosed with her doctor diagnosed Angie, that's when she mentioned about the therapies, and she mentioned about the regional center too, and she was the one who referred Angie to the regional center, and somebody get in contact with us, and then that's when Angie started. A couple of months after, she started with in-home therapy. So somebody came to the house and started teaching Angie how to play, how to put the little cubes in a container, and in her own room, in her own space, and she feels very comfortable with that.
When he came to our house, I had no clue what I was going to deal with. All I know is that I had a child with a disability. I was scared and didn't want to actually, contend with anything, but Peter, his name was Peter, came from Lannerman to assess and actually to speak with us, to give us that support we needed, to let us know that they were there and that everything was going to be fine. He spent a lot of time with us. He talked to us, told us about the early intervention, about the things they could do, the therapies, to get him going and get that stimulation. It was very good. It was what we needed to hear, that there was going to be something very special happening.
Center-based infant development programs are designed for children with more global, significant delays, medical or behavioral challenges that may not allow them to benefit from a typical preschool. Neighborhood preschools are for toddlers ages 2 to 3 who would benefit from social and learning experiences beyond an in-home or center-based program. It allows for the child to socialize with peers in a structured environment. Regional Center may consider any of these programs based on the child's assessed need and age. Early intervention services may also include therapeutic services such as occupational, physical, or speech therapies. Occupational therapy is provided by a licensed occupational therapist to address fine motor, feeding, and/or sensory delays. Physical therapy is provided by a licensed physical therapist to address gross motor delays such as crawling, walking, maintaining balance, and other physical interactions. Speech therapy is provided by a licensed speech therapist to address communication delays. The focus is on speech and language. The transition process begins when a child approaches his or her 3rd birthday and the Early Start program ends. When a child is between the ages of 30 to 36 months, the service coordinator will make arrangements for a transition meeting with the family and the local school district representative. The meeting is a referral process to the school district to determine if the child will be eligible for special education program for infants and toddlers. At the same time, the regional center will assess your child to determine ongoing regional center eligibility. To be eligible for ongoing regional center services past the age of 3, a person must have a disability due to one of the following conditions: autism, cerebral palsy, epilepsy, intellectual disability, or a disabling condition closely related to intellectual disability or requiring similar treatment.
Early intervention is a must. It is a must. It's mandatory. You have to start your child in that. That is the most important and crucial beginning of life for them. That part will help them as they're growing and developing to succeed, to go on to the next level that they need to reach, and go on to the next one and the next one.
The Early Start program definitely helped my child tremendously. We as parents can only do so much, but we don't know how to help a child walk when they have, a diagnosis. Coming from a background of a doctor telling me your daughter's never gonna walk, how am I supposed to teach my daughter? So we needed someone that knew what to do in order to assist her. If parents have any concerns with their child's development, you should go with your gut feeling. A lot of times we go and we seek to speak to the doctor, and the doctor might say, it's just a phase, they'll get over it. But you as a mother, you have the intuition that something's not right. And if that is what you're feeling, then seek the help that you need.
Don't wait. Refer your child right away. Your early intervention team is ready to work together. For more information, please visit our website at lanterman.org or speak to your service coordinator about your options.